social, cultural and community engagement in mental health. Daisy, thank you very much.
Thank you very much. And it's a pleasure to be presenting to you today. I'm going to be speaking specifically about the role of arts, culture, heritage, libraries, community groups and volunteering within mental health. And this really builds on a lot of what you've already heard today, as these activities are essentially multimodal mental health interventions, in that they combine lots of different factors that we know are beneficial for mental health. For example, sensory activation, emotional evocation, cognitive stimulation, social interaction. And we know from research that these can lead to different psychological, physiological and behavioural pathways that are then linked in with either the prevention or management of mental and other health conditions. But I think there are two things about these types of activities that are particularly strong. The first is that because these kinds of social and cultural activities are generally leisure activities, they're non-medical interventions, people tend to do them for the pure joy of engaging, and therefore there's this intrinsic motivation for people to get involved in these activities. But also we have a very vibrant culture and community sector within the UK, which by my count involves nearly 1 million different assets that promote people's engagement with these kinds of activities. So if these activities are affecting our mental health, they're arguably quite a major in-kind resource to mental health and to the health sector generally within this country. So with this in mind, at UCL, we're leading research particularly to understand which types of engagement are linked in with which types of mental and physical outcomes, what the mechanisms are that might underpin this, and who benefits most, and then in particular how we can then use this to encourage engagement in these different activities. So we have a number of ongoing programs of work, and these include laboratory studies particularly focused on biological mechanisms underpinning these effects, behavioural studies, intervention studies including clinical trials and implementation studies, and also population studies. And what we're finding from these studies broadly is that there is consistently evidence that engaging with these kinds of cultural creative activities is linked in both with the prevention of mental illness and also supporting people with the management or recovery from their symptoms. So for example, using some of UCL's cohort studies, we found that people who engage more with these activities have a lower risk of developing mental illness if they're free from mental illness in the first place. Notably, these results are found independent of demographic and socioeconomic factors and also independent of other health conditions and other social and other related behaviours. Also, they're found across lots of different statistical techniques that we use and also across multiple cohort studies. We also find that engagement with these activities is linked in with management and recovery from symptoms. For example, individuals who have depression who take up a new hobby are nearly 3 times as likely to recover from their depression. And this is something that we see repeated across intervention studies as well. For example, in the last few years, we've conducted studies for adults with mild to moderate mental illness within the community, and we found that drumming across 10 weeks can help to reduce symptoms of anxiety and depression compared to people who don't engage in this activity. And notably, we also find that these results actually can last for around 3 months following the end of such an intervention. We've also found that in women who have moderate to severe postnatal depression, engagement in weekly singing groups with their babies for periods of 10 weeks is actually associated with faster recovery in their symptoms compared to either social support groups or usual care through the NHS. And this has in fact led to a new service that's now being commissioned in South London to support mothers with the condition. And we've also looked at physical conditions such as cancer and how we can support mental health in this population. In trials with the Royal Marsden hospitals, we found that people who engage in choirs who were affected by cancer have improvements in their levels of anxiety and their well-being over 3 and 6 month periods. But of course, a really key question is why it is that we're seeing these changes as a result of engaging in these types of activities. So we've developed a number of studies over the last few years looking at these mechanisms and trying to develop new theory around how things like the arts can affect our mental health. One of the things we've looked at in particular has been emotion regulation, and we've developed a new theoretical model for how these kinds of activities can actually help us to regulate our emotions and therefore deal with the demands of daily life. And we found in particular that these activities can either help us to avoid stresses in our lives, such as distracting us from worries or anxieties, or helping us to avoid negative problems. They can also help us to approach some of these problems, including discharging negative emotions in a kind of cathartic way, or giving us the time and space to actually focus on our problems and reappraise them or problem solve. And they can also help us to build our own sense of self so that we feel more capable of tackling these challenges. We've conducted studies then when we've compared people with moderate depression to people without depression in how they use these emotion regulation strategies when they're engaging in creative activities. And our depression group have got black bars and our non-depression group have got grey bars. And as you can see, these graphs are pretty much identically mapped onto each other. In other words, we don't find any difference amongst people with and without depression in how these activities can help them regulate their emotions. And this is important in light of other research which suggests that some people with depression can actually have more muted or blunted emotional responses to activities that they engage in. We've also looked at some of the biological mechanisms that could link this, and we've found across a whole range of studies that engaging in arts and creative activities can help to reduce stress hormones. For example, going to concerts can reduce levels of cortisol and cortisone, notably both from classical music concerts and pop music concerts. And we've also found that across longitudinal arts interventions, we're also finding differences in inflammatory immune response. So, for example, if we've compared levels of pro-inflammatory cytokines and anti-inflammatory cytokines, we find shifts from a more pro-inflammatory profile to a more anti-inflammatory profile over 10-week interventions, which mirrors research that's been done on other kinds of interventions in depression. We've also looked at some of the behavioural and social mechanisms underpinning this. For example, we've found that activities like drumming can help to build social resilience amongst participants, as well as enhancing their well-being and reducing their symptoms of anxiety and depression. And this improvement in social resilience is linked in with these other mental health outcomes, suggesting it's one of the ways these activities are helping to build people's mental health. And we've also found that activities like mother-infant singing are associated with increases in mother-infant perceived closeness or bonding compared to other types of mother-infant interactions, and that these improvements of bonding are linked in both with affective symptoms but also with decreases in stress hormones. We've also looked at things like skills development, and what we found is that people who engage in these kinds of arts activities, they often report learning as a result. This development in new skills can also build self-efficacy, meaning that doing something like a drumming group for 10 weeks isn't just about the drumming. It builds people's confidence to go and try something new afterwards. And in fact, we've done lots of qualitative studies showing that participants in these kinds of interventions are more likely to go on and go for job interviews, take up other activities, and also look at things like moving into more secure housing. This has been shown in particular for people who are homeless who engage in these kinds of arts activities within the community. So we're looking here about how this is actually a kind of spin-off effect that can happen as a result of engaging in these kinds of arts activities. We've also looked at aspects of adjustment. For example, in children, we found that at age 7, if we look at children who are considered behaviourally settled, then we find that those who are more engaged in creative activities have a lower risk of becoming maladjusted by the age of 11. And this is suggesting that the importance of these types of activities within primary school in helping with childhood behaviours. But the problem with all of this is despite the fact we've got this very much growing evidence base about the benefits of these activities and an enhanced and growing understanding about why this is, what we do find is that participation in these activities is very much skewed. Not only is there a social gradient in terms of who engages in things like arts and creative activities, but there's also differential participation based on mental health. Particularly, we find that people who've got low levels of happiness or depressive symptoms are less likely to engage in these activities compared to other people. And these are arguably the ones who could be benefiting the most. For example, we're finding 22% lower participation in popular activities like going to the cinema or live music events, and 39% lower participation in high art activities like theatre or museums or exhibitions or concerts. So one of the programs we're now working on is delivering a whole suite of studies looking at behavioural interventions and how these can be used to try and encourage engagements amongst people who could benefit from this. And this really brings me to the impact of this work that we're trying to achieve. In particular, we're trying to support enhanced individual engagement with these activities. So we work very closely with the BBC, including as the science partners to the UK's Get Creative Festival, which is an annual event focused on creativity and mental health. And over the last 2 years, we've worked on around 30 or 40 different radio and television programmes on this topic, and we've run 2 citizen science experiments involving over 100,000 members of the public in collecting new data. We also work a lot with community organisations to try and support them to be able to lead inclusive and effective programmes. And a lot of this is through our March Mental Health Network, which focuses on social, cultural and community assets. This now involves around 1,000 researchers, community organisations, mental health practitioners and policymakers to try and develop new evidence and practice in this area. And we also are working on a policy level. For example, we're involved in the rollout of social prescribing, whereby GPs and social workers can now refer people specifically to these kinds of activities with the community, and we're working with NHS England, the Social Prescribing Network. We also work with UK government and some governments abroad, and we're also producing new policy reports with World Health Organization on how countries could be making more use of their cultural sectors to try and support good health. So I think overall, this is an area that's got huge potential. I think that we've heard a lot over the last few years about the potential theories about why we have these activities like arts and culture within society. We know we've had them around for around 40,000 years, but what we're starting to see now is that mental health could well be one of the reasons that these activities are included within our societies. However, there are both opportunities and challenges. In terms of the opportunities, we've got a very active and energetic grassroots community organisations who are keen to work in this space. We've also seen increasing engagement with things like social prescribing from the government to provide direct referral pathways through to engaging in these activities. But in terms of the challenges, we're aware that these kinds of activities are often undervalued within societies, both in the UK and internationally. For example, we're seeing the deprioritisation of these topics within schools, and we're also aware that these are often the first things to lose funding in times of austerity. But if our research is right, then what we're actually suggesting here is that by cutting budgets on these kinds of activities, it may actually be having more of an impact in terms of mental health within societies. And therefore, I think there's a key role for researchers here. First of all, to continue building this evidence base so we understand it better. Second, to start getting more specific about who it is that can benefit. And when we say mental health, exactly what we mean by that. A lot of the research so far has focused on mild and moderate mental health generally, but we've got a lot of work to do to identify where there are specific mental health conditions where people could benefit from these activities, whether they work best as alternatives or adjuncts to other types of mental health treatments, and particularly where there is any kind of promise for people with more severe mental health conditions to be engaging in these activities as well. But for that reason, I'm delighted that this topic is therefore being foregrounded within the Institute of Mental Health. Thank you.